every parent of a newborn is going to be, really careful and really worried about their child when they bring them home from the hospital. And one thing that parents have heard a lot about in the news, or they've heard a lot of their friends talk about, or they know somebody that this has happened to, is what we call SIDS, or Sudden Infant Death Syndrome. In 1992, the American Academy of Pediatrics released some recommendations that babies sleep on their back. This was called the Back to Sleep campaign that many people have heard about and has been really strongly implemented. And the Academy of Pediatrics has made some recommendations to help prevent SIDS. Number 1, put your baby to sleep on their back. Number 2, your baby should be sleeping on a firm mattress pad with a tight fitting sheet. Number 3, keep soft objects out of your baby's cribs. No stuffed animals, no toys, no extra blankets. Number 4, do not smoke while you're pregnant, and do not smoke around your baby or if your baby is in the house. Your baby should sleep in their own bed, as close to your bed as possible, but not in the same bed. Number 6, if you would like to use a pacifier, please do. However, if your baby falls asleep, do not feel the need to put the pacifier back in their mouth if they are not awake. Number 7, do not overheat your baby. Your baby should be wearing the same level of clothing that an adult would feel comfortable in that temperature. Extra heaters, extra blankets are not necessary as long as you are comfortable in the room wearing the appropriate amount of clothing as well. There are no products that should be used to help prevent SIDS. Baby monitors that claim to help reduce SIDS or prevent SIDS have not been shown to be effective and are unnecessary. Tummy time should be celebrated and played as much as possible during the day when your baby is awake. We say frequently back to sleep, front to play, and you should be playing with your child as much on their stomach as possible. And then the final recommendation is that we should remind everybody that we know and everybody that cares about your baby that when they put your baby to sleep, they should be to sleep on their back.